So good afternoon, everyone. My name is Suzanne Wood. I'll be chairing the session today. So I'd really just like to say welcome and thanks for joining the session today. I see some people are already popping in chat where they're from, so please do that. That's really nice. So thanks for joining the session. It's a really important topic and I think just really timely as all of you working out there in the health and care system will know, system's still under enormous pressure and with many staff who are feeling kind of physically and emotionally kind of drained and exhausted from what their experience over the last 8 months or so. And we're really conscious that those pressures and feelings are going to be shared by many of you here today, and we really appreciate you taking the time to join this conversation. So as well as hearing from our speakers today, we hope that we can create some space for you to think about your own well-being as leaders in improvement and what you need to do to support your own well-being so that you can support your colleagues and teams as well. Oh, sorry, Jake, could we go to the next slide? And probably the next slide after that, actually. Thanks very much. So over the next 75 minutes, you'll hear from 3 fantastic speakers who'll bring their insights and reflections on how we can ensure staff engagement and wellbeing is a national priority, drawing on learning from both England and Scotland, as well as hearing some practical examples about how individual teams and organisations are seeking to do this on the front line. There'll be a chance for Q&A, so please do pop your questions in the chat, and then we'll be breaking out into a short session where you can reflect on what you've heard and have a chance to think about your own wellbeing. We'll be using a resource called the Wheel of Wellbeing. Next slide, please. Great, so this is the team who will be supporting the session today, both in front of and behind the cameras. So John Drew and Joanne Matthews bring their experience and insights from their work at a national policy level, and Jo Cook will share her learning from her time working at the front line in the COVID response, particularly her work at the Nightingale in London. I'll be chairing and facilitating along with my colleague Tracy, who will lead the Q&A discussion with the panel and the breakout session. Anandita is your friendly face behind the chat box. Do pop in questions, observations and useful resources as we go along. And Jade and Shah will be providing tech support behind the scenes. So hopefully all will run smoothly. Next slide, please. Great, so just a quick word on technology. We do have subtitles available. If you'd like to use them, click on the closed caption option at the bottom of the screen, the little double C, and Shah will just pop those instructions in the chat as well. One of the breakout sessions will also have subtitles, so if you would like to join that session, could you please drop Shah Bowden a direct message in the chat now, and she'll make sure she puts you in the right group. The session's being recorded so that other Q members can watch it later. And where possible, we're encouraging people to have their videos on, particularly in the breakout room, because it will just help us have better quality conversations, we think. And just another reminder, though, to keep your microphone mute if you're kind of in a noisy spot. Great. Next slide, please. So before I hand over to our first speaker, and I'm really hoping John is in the room. There's so many people I can't see him, but that's good. Just to really, hi John, just to get us into the topic, just a couple of quick questions we want to put into the chat and get your responses on, just to help kind of warm us up a bit. So first question, please. Jay, could you just move that on? Oh, it's not coming up, that's okay. So our first question, thank you, is what brought you to the session today? And Adita's popped that in the chat as well. So just give people about 30 seconds to pop in their responses. Ian, I'm glad your feet brought you. I didn't have to travel far to my basement room. Great, join work, so many. And I think so many people feeling so strongly about this. So thanks very much. We'll move on to the second question, but keep typing away if you haven't finished yet. So a bit of a personal question, if you're happy to share. What was the last thing you did to support your own well-being? It can either be professionally or personally. If you're happy to share that, please do. Okay, I can hardly keep up, but lots of exercise, walking, mindfulness. I think we all know how important that is. Someone celebrating Diwali. Brilliant. I think I need an electric neck massager as well. So thanks very much, everyone. I think that was just really to kind of warm us up and get us into the zone. So so without any further ado, I'm going to introduce our first speaker for this afternoon. So that is John. So I'm delighted to introduce John. John's the Director of Staff Experience and Engagement at NHS England and Improvement. And he's going to share his reflections on really how the conversation about healthcare quality and performance can be reframed to really, I guess, think first about people and staff, and what that means for the work of national bodies like NHS England and Improvement. And just to say, please do pop any questions you have for John in the chat, and we will pick as many as we can up in Q&A at the end. So great, I'll hand over to John now.
Thanks, Suzanne. That's kind of you. The chat box seems to go fast at such a high speed that I'm not sure on the other people, but if somebody can. Yeah, I'm just going to share.
We'll do that.
Thank you. Share a few personal thoughts. This is a place near where I live. It's Glasshampton Monastery. You can see that. I actually went here the day after I effectively was made redundant from my previous job. So one of the things that has caused me to reflect on is that I think often we learn the most from the difficult times, but in professional life, we're often encouraged to kind of make out that it's a steady stream of successes. So I felt that I needed a day to kind of get my head straight and think about what came next. So I went here, where there's a group of monks that live there, but they welcome guests as well. And I'm just going to use a little bit of an analogy about the building, actually, to kind of set up the discussion. So if you can move on, please. So you could say that the front door is about quality, and you would say that is true of the NHS as well. The thing that brings you here, and I think why many people that are part of the Q community would prioritise this, is it's to improve quality. So if you can just keep moving through the animation, please. So that means effectively on the clock face, that face is the quality face. There are 3 other faces on the clock though, if you can just move on. So the one adjacent to it is the money face, if you like. Once you get inside the monastery, you can see there's that kind of covered corridor. So if you just keep moving. I would say that, I'm sure the monks wouldn't thank me for saying this, but you could say that the thoroughfare is about finance and operations. That's the kind of path that most people walk most of the time. And I would say similarly, if you think about the way things happen in the NHS, I think it's reasonable to say that that is the sort of dominant axis. And you could say that the link between them is productivity, but that's where most of the kind of the decisions are made. Realistically, it's what a lot of time in planning and board discussions would go. So if you can keep moving. But then there's the front door, I said, was quality. And I would say that sort of runs across the traffic, if you like. So it could be the way you come in, but once you're in, there's this busy traffic about finance and operations. And then if you can keep moving again. So what I discovered is on the inside of the building, which is actually an old stable block, it's like a courtyard, there is a door that hardly anybody uses, and it was quite difficult to open, actually. So I've called it the kind of neglected way in. And if you can just keep going on the animation. This made me laugh, by the way. The inscription is, why dost thou rest? Thou art made for labour. So I thought that was kind of quite a good thing for me to think about when I was just trying to reflect on what had gone before and what might come next. And then if you can keep moving again. So what that means, if you animate up, then there's another way in, a 4th way in, if you like, which is the people way. And that's the sort of door that not many people, I would say, necessarily enter the improvement space through. Can you just animate one more time? So, and I think it's fairly obvious and actually well researched that if we look after people well, they're better able to deliver good patient care. So there's an obvious link between the quality and the people axis, just as there's an obvious link between the finance and the operations axis, but they run opposite each other, if you like. So my suggestion really for this session is that actually well-being of people is potentially a good way into quality improvement, and one that might be a bit neglected. If you can keep moving again. So that also means, to my mind, that we need to try and rebalance the conversation about performance, the way we judge how well we're doing, to have a sense that it's all four of these elements that are connected. And my observation, I suppose, and my experience is that the vertical axis on that diagram is where most quality improvement happens. But the reality is it runs kind of opposite, if you like, to where a lot of the organizational power and conversation goes on. So patient experience and staff experience, I would say, is the connection between those two. And health and well-being and looking after our people right now is really about staff experience. What does it feel like to work here? So if you can keep going. So that means that if you could characterize a team, a department, an organization as having a sort of a point along the performance spectrum, from the middle being not doing well to the outside being doing really well, that would look something like that shape. And then improvement, if you can move on, is about increasing that sense of doing well, how we judge performance. A quality improvement, you could say, if you can just animate on, is the improvement on that axis. But I would say it's actually better reflected on saying it's the whole of this. So certainly I would say if we can improve the experience for staff, which would be about extending in the bottom dimension people, that is actually going to be a quality improvement for all sorts of reasons, including, as I said before, if staff have a full emotional tank, they're better able to care for patients. And one of the slight oddities in my mind is how often in organizations, all the love, the attention, the care goes into patients, and we can behave remarkably badly towards each other as colleagues. And that's some of what we're wanting to change with a focus on health and well-being and the people plan. And then lastly, just to sort of summarize and make the link back to what this session is really about on health and well-being, I suppose I've said that I think it's good to recognize that the quality people axis is as important as finance and operations, but it sometimes feels like we're sort of coming at it from a very different angle. And part of, I think, what we want to do in quality improvement is bring all of that together in a way that it's seen to be connected rather than about one thing or another. And then if you can just move on. The people plan, I think, is a big statement because it's really an equivalent commitment, national commitment to the kind of things we might make, like the long-term plan, which is very patient-facing, or we might make about service standards, but it's all about people. The people promise, represented by the rainbow, is a multi-year commitment. I think that's important to remember. What we're saying there is, this is what staff themselves say is important to them. These are the words that they use. And the way we would judge making progress against it is by listening to what staff say. So the staff survey from next year in the NHS in England will be aligned more closely to the themes in the people promise. And then the last thing I would say, and this is, I suppose, an observation that I've had for a long time because my background is really in improvement, is that the culture needed for quality improvement to thrive, I would say, is very, very similar to what is implied as a culture by the people promise. So I think there's an obvious area for collaboration here that we might not have taken enough count of in the past, which is how do we link experience for staff with experience for patients as the heart of quality improvement. So I would say the health and well-being door is a new way in to the same space. And I've been very struck by a conversation the last week or two with a person working at the Royal Free, where there's been a big emphasis on this movement of what matters to you. And I think a great way into this as health and well-being is to ask a colleague what matters to you. Just as we're learning, if you ask patients what matters to you rather than what is the matter with you, you actually end up with a much deeper conversation. So that's a suggestion of a very practical thing we could all do, is ask a number of colleagues in the days and weeks ahead what actually matters to you as a way into this conversation of linking improvement to health and well-being. That's all I wanted to say in terms of setting up the conversation. Thank you.
Great, thanks very much, John. That was fantastic. And I see, not sure there's so many questions in the chat yet, so do add them, but I think lots of personal reflections that this has prompted. So thanks very much. So I'm going to move straight on to introduce our second speaker, who is Joanne Matthews. Could you move the slide on to Joanne's first slide? Great. So as I said, I'd like to introduce Joanne Matthews. Joanne is Head of Improvement, Support and Safety at Healthcare Improvement Scotland. And I think it's fantastic that we get to hear both about some of the experience in Scotland as well as England today. And in particular, Joanne's going to reflect on how you really make the case for wellbeing as a priority, some of the things that John's already talked about, and what it takes to make that happen. So I'll hand over to Joanne now. Thank you.
Thank you, Suzanne, and thank you, John. And a lot of what I'm going to talk about really builds on what John was sharing with you. I'm really lucky to have a role that continues to support improvements in the quality and safety of care in Scotland. And whilst creating the conditions to enable people to deliver safe, effective, person-centred care has formed part of the work that we've undertaken, could I really say that the attention paid to the other elements was equally afforded to creating those conditions? I'm not really sure I probably could. But for many of us, this element is often described within the operating plans and the strategies we see as an enabler to be able to support the delivery of strategic priorities. I think COVID has brought into sharp focus how we need to reframe our thinking and action from enabler to actually priority. And I'm going to share with you some of the approaches that were taken here in Scotland. Many of these scenes in this slide here will be familiar sights within your system over the last few months. And what is clear is that all of these activities have supported teams across the country to be visible, to have their contribution understood and valued, but to bring a real sense of team and camaraderie, a shared purpose, increased agency, of which we've created that space where it's felt safe, resulting in ideas translating into actual actions, that change in the moment and that real innovation coming from the heart of the system. And whilst this helped enormously during this time and continues to do, the theory that underpins that is not new knowledge. John's just described it beautifully, but we have to really understand, why does it matter? If you can move to the next slide, please. In other words, an unhealthy, unhappy workforce will impact on all aspects of quality. Why have I got a picture of a cow here? Well, many of you will know the work of Pleasek, and often he reflects on how we can be like a farmer, nurturing the conditions in which that growth can occur. There is evidence to say that farmers who actually speak to their cows every day and give them names get on average about 60 gallons more milk per year from their cows than farmers that don't. So farmers who are kind to their cows get better productivity. And if you move to the next slide. So we find that same phenomenon applies to human productivity, and importantly in that world of health and care. There's a real strong relationship between staff well-being and the experience of people receiving care, including the safety, the outcomes that they experience, and the effectiveness of that care. So when we think about the flip side of it, that happy, healthy staff results in safer, better care. If you can move to the next slide, please. So how do we maintain the momentum and the focus that COVID brought to wellbeing, moving it from being a commitment and nice words and a bit of paper to actual action? In Penny's session this morning, she reflected on the need for greater alignment across the top, middle and bottom of the system. And this slide really depicts those different elements and the work that we need to do and prioritise within it. So from a wellbeing perspective, this falls into three categories. Our commitment and action personally, that strategic, cultural and operational conditions that are required to be nurtured, created and sustained across a whole system, and nationally prioritising this within policy. And as I said earlier, affording the focus and the attention to well-being in the same way that finance, performance and quality currently are. So if you can move to the next slide, please. So here's just a few examples of how we're tackling this in reality in Scotland. So starting with my own organisation, Healthcare Improvement Scotland. We have within our personal development reviews this year been incorporating a wellbeing element within it. So really providing as an organisational commitment a support to staff to prioritise their wellbeing alongside their development needs. As someone would describe, putting your own oxygen mask on before starting to help others. And from that national perspective, we've got a commitment through the NHS Scotland 3 Rs framework, which is about how we remobilise through this pandemic and support beyond the pandemic. And it describes how we need to create the safest environment and conditions for staff to best meet the needs of the population, putting the safety and well-being of our health and social care staff on a par with what we expect for our patients and those service users. Coupled alongside this, we also have a national wellbeing hub that's been established with online support, access to resources and a national helpline. And supporting those individuals and national priorities at a system level, we have work that's been undertaken through the Scottish Patient Safety Programme to create what we are calling the essentials of safe care. So if you can move to the next slide, please. So these essentials of safe care are a practical package of evidence-based guidance and support that is enabling all Scotland's health and social care system to deliver safe care for every person, every time, within every setting. And if you can move to the next slide, please. And in true improvement style, we've taken an improvement methodology approach to how we design and deliver that. We have worked with stakeholders across health, social care, the third independent sector, housing, carers organisations, to identify and prioritise what are those essentials to support the delivery of safe care. And you'll see within there that underpinning that is those leadership priorities around the culture for safety at all levels. And explicitly within that, and it came through very clearly from all of the groups, that staff well-being, psychological safety, and that ability to enable systems to come together to share and learn was a fundamental part of being able to not only deliver safe care, but ensure that the staff within those services are safe and their well-being is supported. So if we move to the next slide. So if we think about that sacred mission of our services to promote health and well-being in all of our communities, to enable them to live the best, most fulfilling lives, this would be exactly the same for staff as it is for those that we're actually caring for. And how we provide that high quality, continuing improvement and compassionate care for patients and service users, and how we actually make that shift from thinking about staff well-being as an enabler to a national system and personal priority. So thank you. Move to the next slide.
Great. Thanks very much for Joanne. That was great. And seeing that's caused lots of activity in the chat, lots of reflections, and I think some questions to pick up towards the end, but thanks very much. So I'll hand over to our final speaker for today, which is Jo Cook. So I'd like to introduce Jo. So Lieutenant Colonel Jo Cook. Jo is an advanced nurse practitioner in paediatric ENT and tracheostomies at Great Ormond Street Hospital and a colonel in the British Army. So Jo's going to share some of her learning from her time at the Nightingale Hospital in London, which she helped to set up and where she led on staff wellbeing. So over to you, Jo. Are you there, Jo?
It would help if I unmuted myself, Suzanne.
There you go.
Thank you very much, Suzanne, and afternoon, everybody. And I'm really going to give a personal touch to how we implemented some of the more sort of well-being and welfare things at the Nightingale. And it very much overlaps what both John and Joanne have already alluded to. So as everyone I'm sure is aware, the Nightingale was to support London and save as many lives as possible. And we had to do this as safely and as compassionately as we could, given the circumstances and the huge challenges this brought. You know, after all, it was a conference centre. The sheer scale and the speed at which it had to be built was quite breathtaking. And I remember standing in the space thinking, crikey, how on earth are we going to do this? And from an army perspective, we're used to building, you know, hospitals in the desert and an A&E in a car park, but this was beyond anything that I'd ever experienced. And if any of you have ever been to the Excel, it's essentially a kilometre, sort of about a K long, with a load of cafes down the middle, which then became our sort of logistic hub and our command centres. And either side is you know, 2 huge conference spaces, which the plan was to put 2,000 beds. Next slide, please, Jade. But we were also going to ask staff to work in an environment that was alien, that was high risk. And so it was essential that we built safety and support into all the things that we did. And finally, perhaps more importantly, was maintaining humanity and personalisation in the environment such as this. And you can see on the pictures, you know, the top left was when I first arrived, to over a period of 9 days, creating something that was really quite incredible. The pace and scale was fairly unprecedented, you know, like we'd never seen before. And to be honest, the Excel in many ways was very suitable and really went beyond the functional sort of characteristics of the size of the building. And as you can see, the cubicles were built out of sort of exhibition displays. The build was completed in about 9 days, which, you know, exceeded all of our expectations, but it clearly demonstrates when you have a common cause and people that want to make it work, that sometimes the impossible is sometimes possible with that right attitude. Next slide, please, Jade. So I supported, as Suzanne's already sort of alluded to, I supported the mental health and wellbeing. And as John and both Joanne have already said, that people are our key assets. And at this point, people were being bashed and were really sort of incredibly busy. So to get them to join such a project was really quite remarkable. And something like this would excel in this sort of experience, but we may break some of them. And we were very aware that the mental health challenges would be quite heightened, and that risk of moral injury where one feels unprepared and where actions or inactions challenge our ethical codes. And this really was our biggest challenge at the Nightingale, because we didn't know who was coming. We had no idea of any previous experiences or abilities. And of course, like most NHS hospitals, we were asking people to work out of their area of expertise or comfort. So we decided to create a mental health programme that was tiered, a multi-layer process. We certainly didn't sugarcoat it in any way, and we were very clear to staff what they would face. And on induction, we created a psychological PPE, where it was to remind people that stress is okay, that it is okay to be worried and be anxious, and that most of us would actually get through this and manage things ourselves. And it was really to look at their own mental health and how they would cope and what strategies they could use. And we also then incorporated a new training thing called React Mental Health, which was, I have to say, was superb. And it gave people the confidence to have those psychological savvy conversations. Something that both in the Army and the NHS, we've always been quite nervous to do or don't want to do. So in the clinical arena, we encouraged that buddy-buddy system so that we could have that watchful eye over each other. Because you've got to remember, we didn't know each other. We didn't know if you were quiet, if you were outspoken, whether this behaviour was normal for you. We also had welfare walkers, and these were our cabin crew colleagues that had a mix of React Mental Health training and TRIM, which is something that we do in the Army. And the ethos was very much nip it in the bud. Lots of information, as Joanne's already sort of spoken about, but we did very, very much a similar thing. And the message was very much, it's okay not to be okay. And we did business cards with information that you can see on the slide there. We had posters and communicated, and that was the key. And surprisingly, mental health wasn't a stigma. It was very much part of our normal day and was incorporated into pretty much everything that we did. We said we did posters as you came out of the clinical space, encouraging that two-way interaction. And I think John spoke a little bit about people having a say in how we manage things. And we used a thing called the Improve Well app, which was giving staff an opportunity to have a voice. More importantly, a voice that was listened to and acted upon. And none of this was difficult. You know, Joanne's already said it. You know, why do we wait for a pandemic to suddenly roll all of this out? And actually React Mental Health and Trim and the business cards I've brought back to Great Ormond Street. So it is really quite simple to implement. The big thing for me, and working in both the Army and the NHS for a long period of time, that has often been lacking is that visible and compassionate leadership. That effective two-way communication. And the key here at the Nightingale, that it wasn't top down unless it was critical and we had to move fast. We involve the users to inform what needs to change and at a really simple level, and then take their ideas and adapt things. We facilitated this in daily welfare huddles where people, you know, could voice changes. We developed a new role, and I don't know if James is on the event, but James and Dom and Jenny developed a new role called the Bedside Learning Coordinator, and it was a little bit of a take on the trauma coordinator that we use in the Army. And they would go into the clinical arena and they would collect all the data and record SIs or risks or concerns. And they would offer that immediate coordination liaison with the quality and learning team and the governance teams, you know, whereas normally we write a day text, it might be 2 weeks before the issue is discussed. And this really improved safety and practices. And we sort of flattened hierarchies, which was quite unreal in many ways. And with that easy access to senior leadership teams and rapid decision making and focus on what really matters, senior sort of leaders deferred to expertise and not seniority, irrespective of organisational status. We sort of replicated the clinical arena so that people could be desensitised to walking into what was nothing but rows and rows of beds, and often I would go in there and take a breath myself. Those that did engage with the app, which, you know, was most people, had some great ideas ranging from clocks in the clinical area. And when you're building such a beast, you forget about the simple things. But one of the big things that struck me the most was one of the doctors sort of spoke to me and said, you know, these rows of bed and dealing with patients with no interaction from family and knowing who the person was almost like, you know, ventilating bodies. And we had to deal with that sort of quite quickly. And what we developed was the What Matters to Me posters, and they were placed by the patient's beds, and information was gathered from families, from our liaison team. And the feedback from that was it was the single most initiative in humanising what could have been a dehumanising process. And it all went to create a sense of worth and a sense of belonging. And there's something for me on a personal note was the Nightingale bird, and you can see the bird that I've put on my slides. And it brought joy and colour and captured our hearts in a way that I can't really explain. Perhaps it symbolised the beauty out of something that's been so devastating for some. And the big thing was validating that swift decision making based on mutual respect. And I think people really did appreciate that. And it was based on trust rather than singular decision making. So in summary, although it was only open for a short period of time, I think what we developed was a blueprint for how we should, or how we could manage these future rapid sort of established healthcare facilities and support staff in these highly challenging events. And if I was to make it really simple, it was about kindness and it was about supporting each other. And I'll stop there, but thank you very much for listening. Suzanne.
Great, thanks very much, Jo. Well, you've certainly set the chat box alive, so I think lots of really interesting questions and reflections in there. I wish we could do a proper round of applause, but we can't, so thank you to all of you. And just going to hand over to Tracy now, who's got some questions that she's been curating from the chat box. Thanks very much.
Hi everyone. Yeah, the chat box has been alive with lots of comments and lots of questions. I've been jotting a few as we go. I'm going to put some of those speakers over the next 10 minutes or so. Jade, if you could move to Spotlight, that would be great. One of the things that really seemed to kind of resonate most with people was the fact that you need to look after yourself. You need to look after the staff in order for them to look after the patients. And Katie Clark-Day actually put it really lovely, really well. She said, as a patient, we care as much about the staff as we do about our patient well-being, because they're two sides of the same coin. Jo Matthews, I wondered if I could just go to you and just ask for any reflections about, do we need to make the case that patients actually really want staff to look after themselves? They're really supportive of this and see why it's needed.
Absolutely. I think there is continued growing evidence, but also anecdotal in relation to when asking what matters to you, that what they describe as being able to experience care where they have felt listened to, where it has been kind and compassionate. And often you will hear the nurses are too busy. They're far too busy. And there is a concern then about, well, if they're too busy, how are they able to actually be able to support me in my care? So I think there is absolutely a need and an understanding at that patient and service user level around actually those that are taking care of them. We need to ensure that we're prioritising the well-being of those people delivering that care.
Thanks, Jo. And I guess one of the other things that came up in the chat, which John, I might ask you about, is kind of how we know how staff are doing, and the importance of getting kind of real-time data and feedback about how people are doing. I think that you mentioned a people pulse that has been set up. Would you like to share a little bit more about that?
Yeah, I mean, I mentioned that in response to a comment in the chat box, which I completely agree with, that we can't rely on the staff survey once a year as the way to know how things were going. I mean, we wouldn't do that in a family or something, would we? We'd be attentive to what's going on all the time. So that the People Pulse is a way of listening every fortnight, or now it's moved to monthly. And what we did is we've offered it to organisations on an opt-in basis rather than sort of telling people they must do it, because many trusts have already, or employers or systems have already got something of their own that's working. I think, to be honest, that's just the beginning. I think apps, for example, are a way of just finding out on a much more real-time basis. And one of the great things that's happened in response to COVID is that we've had all sorts of offers. I'm sure it's the same in Scotland, but of the use of free apps like Headspace, and all of those are confidential, but the data that's aggregated from them is actually very useful to understand how people are feeling without it being attributable in any way. So there's quite a few ways that the offers that are online at the website that's been put in the chat box, people.nhs.uk, there's helplines, there's text lines, all of that gives us useful real-time information. And then at the same time, we're tracking ongoing research to understand what are the stress, the anxiety levels that staff are experiencing. And as other people have commented, it's not just now, it's the cumulative impact of those over time that can lead people to be quite worn out. And so, yeah, there's a number of ways, I suppose, not just what people are saying in response to surveys, but what we're experiencing in terms of the usage and take up of offers, and then the research looking at the health outcomes.
Thanks, John. I can see a few people also sharing in chat some kind of tools that they're using as well, which is great. Jo Cook, I'm going to come to you next. Jo, there was loads of questions and like people really interested in some of the things you did at the Nightingale. I'm sure people will be keen to follow up with you afterwards if you'd be happy for some of that. But a couple of things that came up in particular, Andrea asked about kind of this term resilience and the challenge of that being sometimes kind of connected to kind of not coping, and maybe if people are feeling low on resilience, does that mean they're not coping? And part of it's language, but maybe part of it is cultural and something else as well. You've talked a little bit about how you encourage people to really talk, but did you struggle with that at all? Was that an issue for you?
It was, I can't really explain it if you weren't there, but everyone was really willing to open up and actually talk. It was bizarre, whereas when I come back to the NHS, everyone's sort of like tight-lipped. But I think the important thing is that we gave lots of variety. So we had face-to-face welfare for some people. We had apps for some people, you know, Headspace we used a lot of the national stuff, as well as the Improve Well app, you know, to gauge the morale and the feeling of the people at the time. And I think that's key, is giving people lots of opportunities, but also making stress and anxiety normal, you know, not abnormal, sort of making this abnormal. And that's the key. But then if it does become a little bit abnormal for some people, is putting the things in place. And we did things like yoga sessions, you know, so it's not just mindfulness, it's having that physical relaxation. And we did we brought in a personal trainer, you know, all virtual, that people could go back to their rooms. You know, good accommodation, good food, you know, it all goes to help with that wellbeing piece. So I think it's about having variety, and that people can tap into what suits them. But no, we didn't find it an issue. It was really bizarre. Everyone was very willing to talk, you know, to the point that my ears bled by the end of the day. And it's a shame that it's not like that everywhere, really, and that there's still a lot of stigma attached to mental health. Someone's just written Easter eggs. Chocolate was really important at the Nightingale. We had 5,000 lint buddies dropped off, and that was a real morale booster, so that was good.
Thanks, Jo. Yeah, it's really interesting, as you say, hearing you talk about just different things will work for different people, and actually just making it the norm to have offers for people however they want to engage seems to really have unlocked something at Nightingale. I guess another question that's come up in the chat, I think Evelyn posed it, I'll just offer it to any of the speakers who'd like to come in, about kind of staff outside of the NHS. And obviously the NHS doesn't have a monopoly on you know, needing to look after people's well-being. Jo, again, you will have seen that in Nightingale and in your work in the army. Have any of you kind of seen examples of maybe where the NHS has worked across professions, or maybe you just have thoughts about what we need to do to really make sure that this well-being conversation stays on the agenda within the NHS, but also kind of in the wider care services?
So I suppose I'll come in on this one. There's a couple of aspects from a Scottish perspective. The first one being the context, and actually for Scotland, we have been in an integrated health and care system now for a number of years. I wouldn't say we're at a fully integrated space as yet, but we're certainly on that journey. So the National Health and Wellbeing Hub that I described and the helpline is something that is open to health and social care staff, but it's also open to carers. So it was made available for anybody who is supporting a person either at home in a different setting. So it was an opportunity to ensure that people were on an equal playing field and an equal platform in the access that they were able to receive. But coupled with that, one of the elements that really supported that the learning system element, which was a key part of actually how we maintain that well-being part, was being able to call out right across the system about how people are maintaining their well-being and pulling that information together into a learning system that people were able to access via both online, digital, webinars, social media, again, from a perspective of equality and access to that information. So it was about moving away from thinking about the response to COVID being a health one or a social care one, and thinking about the response being from a system perspective.
Thank you, Jo. We've probably just got time for one more question now. I might come to you, John, if that would be all right. I guess I'm conscious of reflecting some of the comments in the chats that are saying, you know, obviously not all of the kind of pressures or ills of the NHS can be solved by paying more attention to wellbeing. It's a really important thing that we need to look at, but in some cases, if people are overworked and whatnot. We need to have some practical changes as well. And this made me think of your comment about the different axes. So how do we have conversations about all of those axes, the finance, the ops, as well as the people and the quality drivers? And wondered if you had any thoughts on that.
Well, part of the reason I did that at the beginning is I do think the framing really matters. And so there were some comments in the chat box about the words we use. I mean, it sounds a small change, but I think it's quite profound to move from talking about workforce to talking about people. Because, workforce is generally about how many we've got. And it often is about counting up large numbers in a spreadsheet that's linked to some other spreadsheet that says how much activity we need to provide this year, and that's linked to some other spreadsheet that says how much money have we got. Whereas people is different, isn't it? I mean, there was a very powerful unconference that I went to earlier in the year, where at the end, people were asked to write kind of comments on bits of paper and throw them onto the stage, and then they were opened up and read. And one of them said, just be a good human. It's not that complicated, which I thought was really good. That in a way, what we're saying is this is about humanity, and therefore the word people is a better framing than workforce, to my mind. We still need to do good workforce planning, because as people have said, if we haven't got enough people, that creates a level of stress on everyone that over time becomes potentially unsustainable. But I would say that within people, you've got workforce, you've got productivity, or some word like it that we might not like, but it's about, are we making best use of people's time and talents? And then you've got culture. And I would say that that's why the people plan is powerful and different, is it incorporates all of those things. But it's certainly, I think I can assure you that in the meetings that I'm in the requests we get for information from ministers, people are very, very focused at the moment on how are people doing. The big opportunity, and I think this is good news, is that we have the chance to claim that territory and keep it, rather than have it all shrink back to where it was before. So, for example, the team that I lead on health and wellbeing had about 10 people in it. It now has about 60 people in it. That may not be the answer long term, but I can be sure that the answer isn't to go back to what we were doing before. So, I think that that is the upside here, is that while people are in this mode and thinking differently, we have the opportunity to kind of reset our behaviours and assumptions in a different place.
Thank you so much, John, and thank you very much to all of our speakers. I could stay and chat with you for kind of much longer than we have. I'm sure others could as well. Thank you for your time and for your words. We're now going to split into breakout groups. It's going to be fairly short and sweet, but we're going to move into breakout groups. Jade, if you could move back into the slides, that would be great. And we've got an amazing number of people on this call on a Wednesday afternoon. We'd love for you to stay for this if you can. If you're not able to and you need to shoot off, please can you do so now, so that we make sure that the groups are fairly evenly split, because we'll shortly be splitting into groups of around 4 or 5 for just under 20 minutes. Next slide, please. So in the activity in the breakout groups, we're going to be inviting you to very briefly look at this tool, the Wheel of Wellbeing. And this was developed a few years ago by South London and Maudsley Foundation Trust, SLAM. Many of you will know of SLAM. And as we probably all know, we've heard a bit today, there's a really compelling body of evidence that links our happiness with longer, more fulfilling lives, with better mental and physical health, stronger relationships, and lots of other psychological, social, and economic benefits. And the Wheel of Wellbeing identifies 6 components of wellbeing and invites people to think about each one. Next slide, please. The web resources which we'll share around the Wheel of Wellbeing is split into 3 parts. So Wow Yourself, which is a kind of do-it-yourself section full of practical tips and activities to look after your own wellbeing. Wow Your Community, which gives you ideas about using the Wheel of Wellbeing in your organisation, your workplace, or your local community. And then Wow Strategy, which if you're involved in policy development or public health or local government, might be of interest to you.